All right, spring cleaning is not just for your home. Maybe there are some personal improvements you've been needing to make as well.
Right. Our next guest is an internal medicine specialist with UCSF. She's here with some ideas to overhaul your health and fitness.
But first, with yesterday's big story about former 49ers wide receiver Dwight Clark admitting he has ALS. We'll start with that. Joining us, Dr. Nicole Van Groningen. About ALS, when you get this diagnosis, is there anything you can do to slow it down? In other words, to have more quality time left?
It's a great question. Unfortunately, like you're alluding to, there really isn't any cure. There is one medication that has been shown to slow the progression and increase overall survival in ALS. It's called Riluzole. So many patients do decide to take that. Unfortunately, it's the only one. Many other drugs have been tried. This is the only one that in studies has been found to be efficacious.
We heard or saw Dwight Clark write about the possibility of a connection between his 9 years in the league and playing football and him getting ALS. Do you think there is that possibility, or at least to CTE, which is the degenerative brain disease as well, that has been talked a lot about for former NFL players?
It's a great question. It's a real hot button issue right now because we know that traumatic brain injury in the past has been associated with some other neurologic conditions, dementia, some cognitive decline. What I can say is that for ALS, the only known risk factors are age and family history, maybe some cigarette smoking. So traumatic brain injury is not a well-established risk factor. However, what I will say is that in 2012, huge study came out that looked at the death certificates of over 3,000 former NFL players. What they found was that people in that population died of ALS at a higher rate than the normal population. So it's just observational. It is not enough to draw deep conclusions about cause and effect, but it does really bring up that question that you're mentioning.
Well, certainly a lot of people thinking about ALS, hopefully donating to causes about ALS. If I could switch topics now and talk about spring cleaning your health. I think a lot of us have completely forgotten all those promises we made back on December 31st at the stroke of midnight. Why is spring really a good time for a bit of a check-in with yourself?
Well, I think it's another one of those times where we, kind of like New Year's, which I was here on New Year's as well, where we reevaluate what are we really doing? What do we want to get rid of in our life? We talk about spring cleaning our homes, and so it may be a good idea to kind of check in with your health, start to spring clean your health, if you will.
You know, throwing away the scale seems counterintuitive because shouldn't you know where you are? You know, if I want to lose those 10 pounds, how will I know if I've lost those extra 10?
Well, you feel it, right?
I'll tell you.
Well, absolutely. So right now, people track the weight on the scale as their #1 marker of how they're doing with their physical fitness. And it's important. It's how we calculate BMI, body mass index. Unfortunately, the BMI doesn't tell the whole story of how you're doing with your overall health. And what studies have shown in the last 10 to 15 years have been that waist circumference, or the measurement around your waist, is actually probably a better predictor of your overall cardiovascular risk, your fitness, your health, as opposed to just the weight on the scale.
We're watching video of people working out here. You encourage to actually schedule less time for workouts.
Yes, this is a little bit paradoxical, I know, but it's a perfect illustration of what we call Parkinson's law. The more time that you give to a task, the bigger that task actually becomes in your mind. So if you were to tell me, I'm going to schedule an hour every day this week to work out, that's going to be so much more psychologically burdensome than if you say, I'm going to squeeze in 25 minutes before I go to work.
Well, I do an hour, not every day of the week, but I try it 3 or 4 days. So is that too much?
Probably not too much. We don't recommend really going longer than an hour unless, of course, you're an athlete, just because studies have shown that if you try to go too long, that can actually decrease adherence to an exercise program. You
also recommend cutting down screen time, which I think we all understand. And I would like to underscore something you say. Throw out the packaged, low-fat, low-carb foods. So often what you make in your own kitchen is 100 times better than what is on a shelf.
Absolutely. We talk about how high-fat diets can actually be really good for you, but the key is focusing on unsaturated fat and eliminating trans fat as much as you possibly can. And that's the processed fat. It's found in a lot of processed foods. So what I tell patients is, be aware if you have to open a package to eat something, unwrap a food item to eat something, look on the label. If you see partially hydrogenated oils, that's synonymous with trans fat. That's something you don't want to be eating any of.
That's the one thing I just don't do.
I know.
I never check anything. I just, you know.
All right.
So I'll take your advice. That'll be my spring cleaning.
We'll have a fall check-in, Doctor.
Great.
Thank you so much.
Thank you, Doctor.
Thank you.